Hi, beautiful people. How are ya? I hope you're having a great day. I think I've told you that our oldest granddaughter is living with us while she's in college. And as I was letting my hair dry naturally, she said, "That's the curliest I've ever seen your hair, Nana." And I said, "Yeah, it'll do this, but I often use the big curling iron. I don't know, I think it's an inch and a half and smooth it all out in the front. And then throughout the week, I'm wearing a ponytail, which stretches out the curls. So I told her I'd wear my hair curly today. So that's the reason for this. And I also wanted to tell you all, a while back, oh gosh, it's probably been a year now, we just had to sit down, let's have a chat. And I was talking about letting the hair color grow out because I had been coloring my hair and getting it highlighted. It can be quite expensive to do that. Now that I'm retired, I I I don't want to spend the money on that. Well, gosh, now it's been 2.5 years since I got it highlighted, but the hair color, I was coloring it too on my own. So I probably stopped that a year ago. So you can see here, this would be all my natural color down to about right here. So it's getting a bit of gray in there, but as I believe I told you all that the gray would probably not be that white silver gray, it would be that more yellowed gray. That's what people with warm tones tend to do is their gray will tend to be a little more warmer, but yeah, it's doing okay. I'm letting it grow. But on with our topic for today. Have you experienced a great and overwhelming event that resulted in anxiety? And along with that anxiety was the physical pain. I mean, if you have fibromyalgia, yeah, you probably, when you experience an overwhelming event, your physical pain gets worse. That's what's called anxiety pain. You may experience muscle tension, body soreness, and headaches. If you have an anxiety disorder, you know this all too well. But if you have fibromyalgia and anxiety, you also are all too familiar. Don't get me wrong, you can learn to manage chronic pain and anxiety pain. But today, I want to explore anxiety pain and what the research says. This is a long video, so I have sectioned it off into two parts. Today is part one. This is a hard one for me to talk about, both of these videos, but I feel that it's very necessary. I tend to put off anything that has to do with anxiety, but I think we can all learn and grow from this. So here we go. I'm giving you a trigger warning. Some of the following content can be triggering. It triggered me, and why I don't cover this topic often. I had to take frequent breaks while researching. So if you proceed, please take breaks and find things that bring happiness before returning to this topic. Here we go. Let's begin with the different types of anxiety disorders. Everyone can feel anxious sometimes, but people with anxiety disorders often experience fear and worry that is both intense and excessive. My mom protected her mental health because in her day, if you acknowledged that you had some kind of mental health condition, you were labeled crazy. I grew up believing that, but at some point, the anxiety I felt as a teenager didn't seem normal. Did I discuss it with anyone? No, no way, not until my 30s. And then it wasn't until my 50s that I was diagnosed with GAD, generalized anxiety disorder. This is just one type of anxiety disorder. It's a persistent and excessive worry about daily activities or a potential event that hasn't occurred yet. Generalized anxiety disorder is when consistent anxiety hangs around and isn't triggered by causes characterizing this anxiety type. The symptoms might be experienced at any time. It's been said it's like always feeling a little revved up and not in a positive, exciting way. I'll be honest with you. I didn't accept that I had GAD at first. I certainly don't see myself that way, but a psychiatrist did see me that way. I always knew I was anxious. I've always been anxious, and I tend to worry about things I shouldn't worry about. So, this diagnosis was profound for me and helped me to accept myself and seek God's help in everything, as well as a therapist's help multiple times. What I'm trying to say is that sometimes we don't see ourselves in the way others see us, and our own reality may be tilted a bit. So ask others around you, or better yet, seek a psychologist or psychiatrist's help if you feel that there's something just a little off. Panic disorder is when panic attacks occur and you fear that you'll continue to have panic attacks. It's overwhelming. Social anxiety disorder is when you have high levels of fear and worry about social situations that might make you feel humiliated, embarrassed, or rejected. Agoraphobia is when you excessively fear, worry, or avoid situations that might cause you to panic or feel trapped, helpless, or embarrassed. Separation anxiety disorder is when you excessively fear or worry about being separated from people with whom you have a deep emotional bond. Specific phobias are an extreme fear of objects or situations that pose little or no danger but make you highly anxious. This leads to avoidance behavior and significant distress. Obsessive compulsive disorder is when you have unwanted thoughts and fears, for example, of germs, and that causes you to compulsively perform rituals such as constant hand washing. The obsessive and compulsive act gets in the way of daily activities and causes you a lot of distress. Never feel ashamed or embarrassed about your situation, but please seek help. Living with OCD can take a toll on the whole family because they take a great deal of time and reduce quality of life and gets in the way of daily routines and responsibilities. Post traumatic stress disorder is when a traumatic event triggers this type of anxiety. Some people may experience panic attacks or more general symptoms like sleep problems, muscle tension, or constant worry. The symptoms of PTSD may appear to come out of nowhere, but are often rooted in a past traumatic experience. PTSD is life altering, and it was a problem for me in my teenage and young adult years. So, these are just a few examples of anxiety disorders. If you have a pervasive anxiety problem and have not sought help, please do so. It may save your life and help you to live. Perhaps your family physician or primary care provider could be the first person that you go to. They can determine how severe the anxiety is and recommend medication, therapy, or both. An anxiety disorder diagnosis occurs when symptoms last over several months. Most people don't seek help for years. An overwhelming fear and worry is usually experienced that is intense and excessive. Usually, we will avoid the situations that make us anxious, but not always. These feelings are typically accompanied by physical tension and other behavioral and cognitive symptoms. They're difficult to control, cause significant distress, and can last a long time if untreated. Anxiety disorders interfere with daily activities and can impair a person's family, social, and school or working life. The most common symptoms of an anxiety disorder are the following: feeling irritable, tense, or restless, trouble concentrating or making decisions, experiencing abdominal distress or nausea, stomach pain or digestive trouble, heart palpitations like pounding heart or increased heart rate, rapid breathing or shortness of breath, trouble sleeping or other sleep issues, sweating, trembling, or shaking, having a sense of impending danger, panic, or doom, weakness or fatigue, and muscle tension or pain. The problem with any of these symptoms is that when confronted with a threat, either real or perceived, our fight or flight response and adrenaline can be triggered. This is a physiological reaction that prepares us for survival. When anxiety is triggered in this way, we can feel a racing heart, sudden perspiration, a knot in our stomach, nausea and vomiting, muscle tension, restlessness, fatigue, difficulty focusing, irritability, and mood changes, along with an inability to sleep or other sleep disturbances. So, the difference between experiencing a one time anxiety stricken moment or consistent problems that reflect an anxiety disorder is that they're long lasting. The symptoms will vary from person to person and will grow in severity based on the cause of stress. But in most cases, an anxiety disorder occurs when a perceived threat triggers these symptoms for a prolonged period of time and disrupts daily life. Physical signs are common, but you can also experience mental and emotional signs as well. Fibromyalgia is a chronic disorder featuring muscle pain and tenderness throughout the body. Fibro can affect anyone at any age, but you're more likely to develop fibro as you grow older and if you're female at birth. Not everyone who has experienced trauma in their life will get fibromyalgia, so it's widely accepted that an anxiety disorder, or depression for that matter, are not the cause of fibromyalgia, but may contribute to it. So many other factors must come into play before fibro occurs. It's a whirlwind of events, and genetics plays a part. Emotional trauma has been found to be more common in fibro patients than physical trauma. How a state of overwhelm translates to chronic pain may have to do with how our body reacts when faced with extreme distress. With so many factors contributing to the onset of chronic pain, there are some that many don't realize are the cause. anxiety has been discovered to be a common factor, according to advanced pain management, and why you may have chronic pain issues. And the worst part of all is that chronic pain can also cause anxiety, for sure. A bad cycle of worry and pain can make our life seem unbearable, and it's important to understand how these two problems correlate. If you're dealing with chronic pain, then it's no secret that stress comes along with it. Whether you're stressed from never feeling relief from your fibro pain, or because those around you don't understand your pain. And stress is a common factor that contributes to anxiety. Eliminating stress may prevent anxiety from taking over. Sometimes that's easier said than done. Anxiety can sometimes create its own kind of pain that can soon contribute into chronic pain problems. Chest pains from panic attacks, headaches from stress, and even muscle pain from constant tension can occur. That's usually my problem. We'll continue this topic in part two and the treatments that can help us with these in part two. So I hope this all made sense in part one, and I hope you learned something. I send you gentle hugs and support. Love you.